Hi, I'm Sarah Sedke. I'm a hospice and palliative care physician, and I'm so excited to be part of the By the Bay Health team. I actually got interested in palliative medicine and ultimately By the Bay Health when I was a hospice volunteer in the summer in high school and college. I think that experience really is what led me into medicine and ultimately in palliative care as well. And then working as an outpatient palliative care provider at UCSF, I was often referring patients to Hospice by the Bay at the time, and had just really incredible experiences watching the By the Bay Health team take care of my patients and collaborating with them, and ultimately that's really what made me want to work here. So I completed medical school as well as my internal medicine residency in New York City. And after that, I decided to make the big move across to the West Coast and completed my hospice and palliative medicine fellowship here at UCSF. My plan was just to stay for a year and go right back to New York, but here I am 5+ years later in the Bay Area. I grew up on the eastern shore of Maryland, and I'm the first person to tell you that Maryland blue crabs are the best seafood on either coast. I am the daughter of a judge and a physical therapist, and so they really emphasized education and service to community. Since moving to the Bay Area, I fell in love, got married, and am now the very proud and tired mom of a 5-month-old. So when I was in medical school, I had a really strong interest and did quite a bit of community work with syringe exchange, really this philosophy of harm reduction. And I think in many ways that philosophy aligns really beautifully with hospice and palliative medicine. This idea that we, take patients and families where they are and support them, in that journey, as opposed to trying to necessarily modify or fix things. And I think that prior experience with harm reduction has really helped me be a better doctor overall, but in particular a better palliative care physician. I really thrive on relationships. So building and curating relationships with patients and families, as well as with colleagues. I think that's the part of the work that is interesting and meaningful to me, and also just makes it very human. And I found, especially with the COVID pandemic, that relationship piece, that connection, has felt especially important.